Unvaccinated patients continue to fill up Canadian hospitals, leaving doctors and nurses at their breaking point.
We're just as COVID exhausted as everybody else, and things need to change.
For a system under stress, experts are hopeful this little pill, Molnupiravir, could offer some alleviation. Currently, all Health Canada approved COVID treatments require a medical professional to be administered. Similar to Tamiflu, Molnupiravir would be taken at home orally to help dampen the effects of the illness.
Oral therapy is always going to be easier to give, but I think the important component is that this is not a cure for COVID.
In clinical trials, drugmaker Merck says the twice-a-day antiviral reduced hospitalizations and deaths in COVID patients by 50%. Matthias Gutter and his team at the University of Alberta tested the efficacy of the drug before Merck's results were even released.
The drug doesn't really inhibit the virus, but it causes the virus to make too many mistakes,
forcing it to make a sloppy copy that is no longer infectious. Gotti says it's important to get the drug to patients soon after diagnosis.
Molnupiravir can be taken much earlier before the virus has caused already so much damage that antivirals don't work anymore.
As early as 5 days after infection, according to Merck's trials.
It provides another way that we can effectively treat people and reduce the risk of hospitalization and death, which is incredibly important, obviously. But it doesn't mean that those who haven't been vaccinated should sit back now and say, I don't need to worry.
With no shortage of shots in Canada, that, experts say, remains the first and best line of defense. Mauracher, Global News, Toronto.